As a rheumatologist, I often get asked the differences between all the different types of arthritis. Well, in fact, honestly, when people come in, they just talk about arthritis and often lump it together. But some people these days that are a bit more savvy, they start getting online and reading that there are really different types. So I want to demystify this today. I want to offer some explanation and I want to offer some perspective. So even though there are often determined to be over 100 different causes of arthritis, and arthritis simply means joint pain, really I break it up into two big categories. We have systemically inflammatory processes and we have non-inflammatory processes. The non-inflammatory process is what I'm going to start with first. So a lot of times when people have joint pain, the most common cause is osteoarthritis. This is degenerative wear and tear arthritis. This is what my grandmama had as she got older, God bless her. This is what is bothering me a little bit in my knees from time to time that my kids tease me about as my knees and ankles pop as I walk down the hall. Worldwide, in the US, this is the most common cause. And again, while there is some localized inflammation with this, it's not a systemic process. So you can think about it in this regard. If your computer isn't working, it could be because, I don't know, maybe your 2-year-old unplugged the keyboard. That's a localized problem. You plug it back in, you're back in business. Our inflammatory arthropathies, autoimmune diseases, for instance, that cause rheumatoid arthritis, lupus, psoriatic arthritis, and so on, are systemically inflammatory conditions. Now there's a big difference both in the cause of these issues and in the manifestation. So for a lot of these illnesses, and I'm going to focus right now on our autoimmune conditions, they're rooted in your body's immune system. Those errors in the immune system spark systemic inflammation, which manifest in your body as pain, stiffness, swelling, redness, and warmth, often in multiple joints, your tendons, your bursa, and so on, okay? So these issues, because they're systemic, you can think about it still using that computer analogy. Now imagine if your computer isn't working, not because the keyboard isn't plugged in, or because your monitor is down, but because the power is out to the whole block. I can try to plug that computer in a million different places. I can get a brand new monitor or keyboard and it still won't work because there is a systemic issue. So again, the big differences are in the cause. What is causing your arthritis? And as a rheumatologist, I feel that that's one of the first jobs that I need to figure out even before we offer you a treatment. We're not in the business of just treating chronic pain. We're in the business of identifying the root cause and then offering a comprehensive plan of care.